Thank you very much for the Innovation Award and for acknowledging our team today. The Center for Program Integrity was looking for a full lifecycle API gateway, and we decided upon the MuleSoft product for our pilot. The pilot has allowed us to bring multiple data sources together from multiple data centers in real time to view data in different ways than before, reduces overall operational cost, time to deployment, improves efficiency and utilization without the need to develop new standalone systems. As far as the future, in February of this year, we entered into another one-year pilot with new and expanded objectives. The secret to the program's success has been the dedicated people, teamwork, and the enthusiasm for what we are developing. To the API Gateway team, CGI, and MuleSoft, thank you.
First of all, I wanted to thank the Fed Health IT reviewers for recognizing the CCSQ project for this Innovation Award. This is the first Innovation Award for our team, and we are all very excited to be recognized. I also wanted to thank the EDD team members who contributed to the success of this project, specifically Philip Connor for his dedication and knowledge. Without his assistance, this effort would not have been successful. Our program is a little different than most programs within CMS. Our Data Analytic Coaching Services program focuses on coaching and assisting the Evidence Development Division team members on how best to leverage existing CMS assets and empower them to be more efficient and productive. Our program's goal is to improve ED's ability to be independent and utilize all the data analytic resources within CMS. This investment in the development of the ED workforce will continue to be the primary benefit of this program, leading to lower costs, faster response times, and greater productivity for our team. The data analysis and research activities within the Evidence Development Division continue to grow, and such we anticipate the need for additional analytic services to be provided as well. Our team looks to leverage this model to continue developing the ED team and supporting CMS beneficiaries and provider communities. If I were to capture our program's innovation success in 5 words or less, I would use the 5 C's: coaching, collaboration, commitment, communication, and creativity. As our division's goals and objectives change, I anticipate this contract to change as well. However, this program will continue to focus on improving the knowledge and awareness of data analytic capabilities within CMS. Thank you again.
On behalf of the Centers for Medicare and Medicaid Services and our partner National Government Services, NGS, I want to thank Fed Health IT for this award. At CMS, we have been working for some time to change the perception of government-customer relations, so being recognized for innovation means a great deal. Our project, the Advanced Medicare Provider Systems, or AMS, is an example of how the team at NGS was able to take a developing technology, in this case a low-code platform, and build a customized and scalable customer relations management system that takes the data we already have and puts it to work in ways that hadn't been previously thought possible. The result is a system created by and for users so that they can give our beneficiaries through healthcare providers the best service possible without compromising our standards for privacy and reliability. As pleased as we are with AMS, the real persistent benefit here is skills that were acquired in developing it. As proud as we are with AMS, we know we can always make it better. And with what we've learned in the process, we know it doesn't have to be expensive or time-consuming to make these improvements. This development process has been a positive experience that will enable great possibilities for the project, like a potential mobile app and even a voice assistant. The 5 words we would use for the success of our program would be, don't be afraid to try. We learned as much or more from our failures as we did from our successes, and knowing that gave us the confidence to try things we otherwise might not have. Projects like AMS contribute to the overall success of our provider customer service program. I want to thank everyone on the NGS team, in particular the members of the operations, IT, and provider communication teams, including Karen Chan, Lee Condon, Emily Fox Squares, Jane Height Syed, Lisa Hare, Josh Heron, Sarah Maharani, Charity Mahiran, Chris Waver, Marsha Wells, Sonia Simons, Ben Cantati, and Krista Yeager. Thank you.
Hi, this is Gregory Crawford from the CMS Centers for Medicare and Medicaid. I am representing the CMS Enterprise Portal Services team and our contractor, CHAGS Healthcare Information Technology. The customers of CMS Portal Services, users, ADOs, and their contractors needed real-time actionable insights to understand a complex operational environment. The CHIT team leveraged machine data tools and artificial intelligence to develop tailored solutions, including KPIs, concise visualizations, and transformative and actionable solutions for our end users. Portal Operational Intelligence delivered strong results to our customers. Increased throughput capacity, reduced outages, provided stronger customer-focused service. The as-is environment lacked full horizon line of sight across multiple data centers and 60-plus applications. Critical data was buried or unavailable. Accessing this data was challenging, and interpreting it was problematic because data streams were not aligned or synchronized. We brought the big picture to understanding by incorporating enterprise machine data into a single view to enhance information sharing and collaboration across teams. Outage prevention is now supported using machine learning through operational patterns and trends. We can now predict and prevent outages 20 to 30 minutes in advance. Time-consuming root cause analysis was reduced and mean time to resolution decreased. The results were impressive. We were able to obtain increased operational visibility and minimize SEV1 events. We handled a 100% increase in traffic load during the 2019 open enrollment with a dramatic reduction of unanticipated downtime. We are now able to reach out to customers in the event of an early signal of a performance issue and reduce or eliminate their impact on the enterprise. We had greater overall enterprise visibility and a significant reduction in unanticipated service interruptions without an increase in staff or compute costs. On behalf of our combined CMS and CHIT Enterprise Portal Services team, we'd like to thank you for recognizing the EPS Portal Operational Intelligence for our 2020 Federal Health Innovation Award.
Please join me in congratulating the HHS CMS Crown Data Discrepancy Support Project, represented by Ray Shalakian, Contracting Officer's Representative.
Hello, my name is Anna Ralph, and I am the Product Manager for the Data at the Point of Care Pilot API. I am so excited to be accepting this award on behalf of the Data at the Point of Care team. This product was initially started with the United States Digital Service and transitioned over to the Centers for Medicare and Medicaid Services, so I want to thank the internal CMS team and the contractor staff at Ad Hoc for taking this product on and continuing its success. But I want to give a huge shout out to the team that got this all started at USCS. That includes, but is not limited to, Shannon Sarton, Mishu Tisneem, Amy Gleason, Nick Robison, Rick Hawes, Ron Heft, Shelby Switzer, and the rest of the USDS team that dedicated their time and effort to DPC. The secret to our success is not really a secret, and I know this sounds cliche, but it's teamwork. Transitioning a product from one government team to another is no easy feat, especially with the complexities of DPC. So teamwork, along with patience, determination, and passion, were all critical to the success of the transition of this product. We are also very excited to announce that we are going to start pilot production testing with a small set of users in June, and will continue to improve the existing technology along with building in new features with an aim for an MVP launch in 2021. I also want to thank the entire DPC community for their engagement in the sandbox environment and their continued feedback and dedication to this product, and I very much look forward to the potential for DPC's impact on the entire healthcare community. Thank you.
Hello, this is Dave Merrill, Business Area Vice President with General Dynamics Information Technology. Please join me in congratulating Gloria Stedding, Medicare Enrollment and Premium Billing System Team Lead and Contracting Officer Representative. Congratulations, Gloria.
is Michelle Jeppe with the Centers for Medicare and Medicaid Services. CMS is launching a simplified and consistent online experience to make it easier for consumers to find and compare care, while also meeting the needs of industry stakeholders who search data that are important to them. To meet the needs of today's Medicare beneficiaries and improve the online Medicare customer experience, CMS is standardizing the 8 existing compare tools, allowing users to access the same information through a single point of entry and simplified navigation. The companion portal, the Provider Data Catalog, will allow Medicare researchers and stakeholders to access the more detailed data that are important to them. It will have an improved interface and intuitive search features to allow users to easily search and download CMS's publicly reported data, better serving stakeholders who use the interactive and downloadable datasets like those currently found on data.medicare.gov. The team can attribute much of the success to the great collaboration between the Office of Communications and the Center for Clinical Standards and Quality.
My name is Jessica Denman, and I'm Executive Vice President of Health Operations at Halfaker & Associates. It is my pleasure to introduce Emmanuel Smirniadis of Centers for Medicare and Medicaid Services, who has earned a FedHealth IT Innovation Award. Mr. Smirniadis serves CMS on the agency's fraud prevention system, and he's being honored today for his leadership on the project. Please join me in congratulating this deserving award recipient.
Chris Martin is currently engaged in the COVID-19 operations mission and has asked me to read his acceptance speech. It is with great honor that I accept this award on behalf of Team FMSG, delivering innovative solutions in order to satisfy our customers' needs. Our vision and goals set the direction, and our strategies drive each of the specific areas managing and operating critical financial systems while delivering high-quality technical solutions.
This is Jason Vollmer from the Centers for Medicare and Medicaid Services, Office of Acquisition and Grants Management. I want to thank FedHealth IT for recognizing the efforts of such an important accomplishment here in CMS. Over a year and a half ago, CMS pursued an interface between its discretionary grant tool and CMS's financial system to automate the entry and posting of commitments and obligations. In the previous state, many of the commitment and obligation processes were manual, inefficient, and subject to human error and timely reconciliation efforts. To address the problem, we developed a financial interface between the two systems. While in development, the interface was expected to comply with Data and Gone Act requirements and support the Presidential Management Agenda, CAP Goal 8, resulting in transparency and efficiencies when closing grant awards, and supporting reconciliation efforts aligning financial account balances between various systems. As the business owner of the effort, I recognize it would not have been possible without the joint effort of all team members in the various functional groups within CMS, specifically recognizing the team members within the Office of Acquisition and Grants Management and the Office of Financial Management. All the individuals that came together to develop and implement this solution deserve all the credit for the award. I don't think there's necessarily a secret to success, however, a few words that do come to mind include teamwork, collaboration, open-minded, agile, and persistence. As we move forward, our teams are continuing to look for areas of improvement in the discretionary grant lifecycle process. We have a goal to continue to strengthen data integrity and make the user experience for both internal and external stakeholders to be as seamless as possible and make the most of technology to drive efficiencies. On behalf of the entire team, thank you all once again.